The mission of the World Bank Group is to help countries fight poverty. The World Bank Institute was set up to complement the traditional work of the bank in providing finance to countries. It supports policymakers and practitioners to drive reform.
So the World Bank Institute connects policymakers and practitioners to others who have done these reforms, and we also try to encapsulate learnings from what has worked in other countries in the form of structured learning programs.
The guidance also.
In order to translate that learning into action and results, you need to help build consensus amongst government and non-governmental stakeholders. The World Bank Institute works with both government and non-governmental stakeholders to help build coalitions and consensus for reforms.
The health practice at the World Bank Institute approaches health system strengthening through a comprehensive learning type of activity. Our idea is that it is not enough to develop technical skills, but more than leadership and coalition skills to bring leaders to really drive reform.
So the results of what they are doing.
We have developed technical skills on more than 19,000 individuals in more than 52 countries. We also have been working in pharmaceutical procurement in Africa. We have 3 countries in Africa that are working in a multi-stakeholder type of approach to develop working plans to improve transparency and accountability on the procurement of pharmaceuticals.
The World Health Organization estimates that countries pay 35 to 45% more for drugs than they have to, and often corruption and inefficiencies in the procurement process is an issue. In this World Bank Institute network, 3 countries, Uganda, Tanzania and Kenya, are working together to share knowledge, information and data.
The key features of this initiative is bringing multiple stakeholders together. And it is important because each of the stakeholders can learn from each other or can use the information from the different stakeholder groups to inform policy decisions.
Medicines for Malaria venture was created in 1999 as a result of collective concern that the malaria treatment pipeline had pretty much run dry. Drugs used to treat malaria, particularly in Africa, had been failing. This was a real crisis because drug development normally takes 8 to 10 years, minimally. MMV was created to respond to that market failure to bring new products for malaria treatment to the market.
What we're doing is we're bringing together the best of academic science, the people that know about the parasite and know about the biology, with the people from the pharmaceutical industry who know how to develop drugs, and then also the people who have the money to fund all of this. What we've learned over the last 10 years is that not one player can do it on their own. It's all about partnership.
Malaria is a killer of children, first and foremost. 85% of the deaths due to malaria occur in children under 5. The treatments available to treat malaria were not child-friendly. In fact, children often vomit, throw up, reject the treatments when they're administered to children under 5. MMV realized this was a problem and early on with Novartis created a partnership to try and address this one major lack in the therapeutic area of treating malaria.
Coartem Dispersible is specifically designed for the needs of small children. And we did the development in partnership with MMV.
In Afghanistan, finding good medical care is challenging. In rural, often mountainous areas, health provision has always been basic or absent, and 3 decades of war has devastated the health system which existed before the Soviet invasion of 1979.
Realizing the difficulty and the problem and the field, Aga Khan and the Ministry of Public Health came to this agreement if we can find a solution, how to reach to those remote areas where there is no social and environmental facilities. The professionals, they are not eager and they are not willing to go to such remote areas. And unfortunately, still, security concerns are there, and they are very remote, very scattered, small villages.
The Aga Khan Development Network, or AKDN, promotes development in Afghanistan, including operating 3 hospitals, 37 clinics and 230 basic health posts. The network has introduced telemedicine to help provide better treatment and healthcare training in remote communities.
So what do you do in your routine clinic?
Afghanistan's leading telecommunications company, Roshan, an AKDN investment, has provided the technical expertise and funding to establish telemedicine links between hospitals managed by the network. Telemedicine, or e-health, improves healthcare for patients by enabling medical staff to use new technology to carry out essential tasks faster and more efficiently, such as diagnosing the health problems of patients in remote rural areas, treating or referring these patients to specialist medical staff, and providing on-the-job training for rural health workers. It's deworming day for the children of Chungruk Primary School in Phnom Penh, Cambodia. Children are receiving drugs to prevent and treat infection from roundworms, whipworms and hookworms, also known as soil-transmitted helminths, or STH.
Children Without Worms target school-age children because they are the population that are vulnerable to infection, and this disease has profound impact on their health and their future lives. The worms sap nutrients from the children, making it difficult for them to stay healthy, for their brains to develop. And if a child is sick, they can't attend school. And everyone knows that if a child can't attend school, they're more likely to drop out. And then there's a domino effect. If they drop out of school, they're less likely to become productive adults, and they're less likely to break out of poverty. Throughout Cambodia, about 2.5 million school-age children will be dewormed with mebendazole donated by Johnson & Johnson. This is a campaign that's organized by the government of Cambodia. Specifically, it's implemented by the Ministry of Health and the Ministry of Education.
We support over 700 programs in more than 50 countries around the world. Those focus areas are broad in scope and include the program that we are talking about today, Children Without Worms.
Johnson & Johnson, we have a quality medicine called mebendazole that treats and kills the worms. So in response to the World Health Assembly's resolution to treat 75% of the children around the world, we've created the program Children Without Worms that both donates and administers the drugs to treat the worms.
Before a child is treated, they are listless, they are lethargic because the worms are sapping them of nutrients. They have a tablet of mebendazole and then they pass the worms and then they become engaged. They're energized, they're energetic, they're ready to learn and to play and to be children.
Here in Sinkoro in Mali, they're having a party. It's been organised as part of NGO Sightsavers' Mass Drug Administration programme, which recruits community health workers to prevent and treat blindness from 2 neglected tropical diseases, onchocerciasis or river blindness and trachoma.
Sightsavers began its activities in Mali in close collaboration with the Ministry of Health, and the activities we undertake are particularly activities against onchocerciasis. We also fight against trachoma and cataracts. That is roughly the main thrust in Mali in regard to the fight against blindness.
The main aim of Sightsavers in terms of health is to prevent and cure avoidable blindness. About 75% of blindness is completely avoidable. The leading cause of blindness is cataract globally, but in Africa we have blinding, what are called neglected tropical diseases, one of which is trachoma and the other is onchocerciasis, or also known as river blindness.
In 1987, the village was almost abandoned due to the severity of river blindness, but because of the mass drug administration programme, it's now under control.
The advantage of the collaboration with Sightsavers is it helps reduce the number of patients. Thanks to the drugs that we receive, we are healthier, I would say. If Sightsavers continues to provide us with medicines, it will probably eradicate the disease. We're counting a lot on this project. At the moment, we are satisfied.
The drug is donated by Merck. It's donated to as many people that need it for as long as is needed. The cost is to actually get the drug from the port of entry to the community and then to sensitise the community and to educate the community about the disease. So it's empowering communities to distribute and control a disease.
At the recent meeting of the 64th World Health Assembly in Geneva, delegates spoke, amongst other things, of global health diplomacy, the art of getting international agreements on public health issues where it's not just medical evidence that counts.
Health challenges today are complex and rooted in social, political, and economic determinants. They are wide-ranging and readily cross national borders. They require global action well beyond the health sector, and have brought diplomats into health debates. Without engaging foreign policy, how can we address the world's most pressing health issues? How will we reach the MDGs?
Those Millennium Development Goals were challenged in Nigeria in 2003 when the medical evidence showed that polio vaccination was effective in eradicating the disease. But the immunisation programme was stopped in one area because a local governor claimed it was part of a Western plot to sterilise Muslim girls. Global health diplomacy was essential to restart vaccination, and the first step was retesting the drug to show it was safe.
The second step was diplomatic negotiations within the Islamic Conference in Islamic countries to invite religious leaders to help resolve the issue, either through fatwas or actual demonstration of vaccination in northern Nigeria. This began to have an effect, but the situation was not resolved until the governor himself decided that he needed to resolve the issue, and he then sought a group of pediatricians who helped him decide that the risk of polio was greater than the risk of vaccine.
Former executive board member of the WHO, Paolo Bus, told me this happens often, that cultural, financial or trade barriers need to be overcome, as well as the interests of the pharmaceutical companies.